Thank you so much. And our last panelist is Dr. Debra Furr-Holden, Associate Professor at the Johns Hopkins Bloomberg School of Public Health and faculty at the Hopkins Center for Health Disparities Solutions. She's an epidemiologist with expertise in drug and alcohol dependence epidemiology and psychiatric epidemiology.
Thanks. So I think this was a great context and stage that got set. I'm going to jump right in and talk about a very specific example. There we go. I want to jump in and talk about a very specific example of sort of action-oriented research and sort of tell one of myself with some real lessons learned about some work that we've been doing in Baltimore. So I'm a drug and alcohol epidemiologist by training. And in Baltimore, we have two sort of big problems that face our community. So Baltimore has shrunk in size by about 1/3 from the 70s to now. We were a city of just under 1 million, and now we're a city of about 635,000. And when people left, there are two things that they didn't take with them. They didn't take their liquor stores, so we have lots of liquor stores. I call it the wetlands. And they didn't take their houses. So we've got a massive problem with vacant housing. And we know that the reason that this is relevant is because we know that there's a link between both blight as well as oversaturation of liquor stores and overall community health. And in a city like Baltimore, one of the major health problems that we face are issues around violence. So there's a strong substantiated link between alcohol outlet distribution and health. And multiple studies link alcohol outlets to not just increase alcohol consumption and the related health harms. That would be sort of the obvious thing, right? The more access you have to alcohol, the more people drink. The thing that I think is more important is that when you have a high saturation of alcohol outlets, it creates a certain climate and structural conditions that give rise to other kinds of incivilities besides drinking behavior. And the main one that we've been able to substantiate is increases in violent crime and occurrences of violence. So we undertook an initiative in Baltimore, and I'll talk about that. And we had a zoning rewrite. And that zoning rewrite created an opportunity to reduce what I'm going to term non-conforming off-premise alcohol outlets. And in short, non-conforming means in 1971, our elected officials and municipal officials had the insight and wisdom to say, we don't want liquor stores in residential communities and we don't want liquor stores next to schools. The thinking was that those places would naturally stave themselves off, the ones that were not in compliance with that new zoning code. Quite the contrary, a few additional ones snuck in, and then those people cornered the market because no new stores were able to come in to those communities. So they have an added incentive to not leave. I'm not gonna go through this, but the point is, as a scientist, I always say I try to keep my white hat on and stick true to the science and make sure that that rigor is there. But there are several studies that show a relationship between both alcohol outlet proximity, so proximity to places where people live, work, and play, as well as density, the density of alcohol outlets, how many there are per population, and these negative outcomes, primarily violent crime. The reason that this is important, and I'm going to focus in on Baltimore, but I'll say that this research has relevance for many urban centers like Baltimore, is because not only is there great variation in both the density and proximity of alcohol outlets in Baltimore, but there's also substantial variations in crime, and those tend to overlay with the liquor stores. Why that's relevant? Because it also has a great impact on morbidity and mortality. And you could literally take these same maps, plot out every negative quality that you could think of, and these things will overlap. To give you another way to look at it, on the y-axis here are the 55 community statistical areas of Baltimore City. This area here, does this have a pointer on it? It looks like it does. I don't know how to turn it on. Yeah, so this is the area called Upton Druid Heights. So if you all remember the Freddie Gray incident that happened in Baltimore back in April, Freddie Gray's neighborhood is right here. He's in Southwest Baltimore, and Upton Druid Heights abuts up to this community. The average life expectancy here is 63.1, and Baltimore's healthiest neighborhood over here, which is Greater Roland Parks, average life expectancy is, oh, this is a little bit off. It's actually 82. So there's about a 20-year gap in life expectancy based solely on where you live. And these two communities are about 3.5 miles apart. So as a public health professional, I'm looking for what can we do upstream, what can we do structurally that will actually shape and influence these outcomes. Because if you think about it, most people don't have a say over where they live. People are born where they're born. One of the things that's really interesting about Baltimore is you get generations and generations of people living in the same communities. And that's how people live. They rely on that social support and those networks, et cetera. And I think people should have the right to be in the communities that they choose to be in. But it's problematic when then it's got this massive inequality around health and well-being. So we have the data. We know that this stuff is happening. We know that there's a profound opportunity to make a difference in this particular area. But what's the big disconnect? Well, while the data are compelling, had been very little political will for change. And as such, there had been very little action. The other thing is money talks. We started to present some of this to our local elected officials and some of our other non-elected but appointed officials, our health commissioner, our police commissioner, et cetera. And we found out that all but two of our city council people, including the city council president and the mayor, were taking money from the alcohol lobby. So they had a stake in not taking on this problem. And then the other big disconnect is that while communities wanted change, their efforts had been insufficient to promote the changes that they wanted to see. So we had little victories here and there, but globally, people just weren't coming together in ways that were productive. So a bunch of myself and a few of my colleagues got together at Hopkins and we thought, who can we be as researchers? Like, what is the role of the academic in this debate and in this problem? And so the first thing that we decided to do was to create a sense of urgency and really make a case for why now. So one of the approaches that we use is we conducted a health impact assessment, and I'll talk, that's a typo, that should say 1,000. We conducted a health impact assessment, and we found out, which is a very potent public health tool. I hope somebody at this meeting will go into detail and talk about health impact assessments, because they really are a potent way to understand the health implications of policies before those policies get implemented, with the ultimate goal of designing policies with health in mind, or health in all policies. So out of the HIA, we realized that we could avert nearly 1,000 acts of violence with a simple 10% reduction in alcohol outlets in the city. We capitalized on some existing efforts. So the city hadn't had a zoning rewrite since 1971, and a bunch of folks came together and said, given that we've shrunk in size, given that we have all these land use issues, it would serve us to sort of look at zoning, look at land use, and figure out how we need to change our zoning to sort of create the next stage for Baltimore. And then we also got a new health commissioner who came in and created Healthy Baltimore 2015, and she did that in 2011. And one of the things that the commissioner called for in Healthy Baltimore 2015 was a 15% reduction in alcohol outlet density, because she realized how impactful that could be on the health of the city. So we started to build some synergy and integrate with some ongoing efforts in the city. We also nurtured existing relationships with municipal officials and elected officials. And one of the most important things was to identify who our allies were and also recognize some possible points of contention and tread lightly. Moving in this world, I have stepped on a few landmines. And at some point during this effort, I actually had a brick thrown through my living room window by one of the liquor store owners that I got into a heated debate with at a public hearing. So anyway, I've learned to tread lightly. And stay away from the window. Okay. And then also be ready to jump in action when called upon. And when I say be ready to jump in action, I really mean as a researcher. And my friend's grandma used to say, baby, if you stay ready, you ain't gotta get ready. And I love that expression because it's really true. It sort of spoke to, we could see what was potentially coming. So our job as scientists were to make sure that all of the science was there, not just the things that we disseminate into the scientific community, but I will say, we have gotten more attention from some of our published articles that we then did press releases on, created sort of community, snapshot executive summaries of those papers, and then disseminated those. So I do think it's very important that we sort of marry the academic dissemination with other types of dissemination. But it really is those academic credentials that had us really have a seat at the table. All right, so the short version with the zoning rewrite, I already said zoning's an important public health tool. I talked about our key finding from our HIA, and then the highlights are that the new code had the potential to decrease violent crime, increase neighborhood safety, as well as increase opportunities for healthy living. So our initial activities, we created alliances with the local foundations to fund that HIA work. We work with the local health departments and willing policymakers throughout the HIA process. So we're very inclusive. Everybody's at the table, everybody's chiming in, everybody gets a say on what the questions are and how things are shaping up. We shared the HIA with policymakers and the results of it in advance of publication. So they had an opportunity to sort of guide and say how they wanted things tweaked in ways that would be impactful, because they were the ones that were actually going to move the legislation forward. And then once we got everybody on board and everybody was sort of had some consensus about what the messaging was that we wanted to say, we published the HIA widely and created a real press buzz. I actually, right around that time, started my own radio show. I got my own radio show in Baltimore. So we did a lot of conversations about it on the radio show. We did other radio appearances on some national radio, op-eds. We testified at all the public hearings. And it was interesting because Baltimore is an African-American city. It's about 63.5% African-American. And I was actually the only African-American on the team. And so one of the things that we decided is that I would do a lot of the public speaking because I could more readily garner some credibility with the community. But it was a collective effort. So I showed up in some of these public spaces way smarter than I am because I had a team of like 15 people prepping me to be the one out in front. And we also conducted workshops, and I got tremendous value out of being in that network of people. And I said, we need to provide this for young people and community people as well. There's nothing worse than having a well-meaning person from the community come to an event and completely bomb their testimony, right? So they're well-meaning, they're under the sort of the weight of what the experience is, and then they get their opportunity to communicate it and bomb. So the same thing that was done for me, we did with youth, and we created these series of workshops to both engage and prepare youth and members of the community. So then what happens? This really takes hold. And I was literally at a function and the mayor was there. And I was sort of talking to her. I said, yeah, we're making all this progress with all this alcohol work. And I'm really happy to see that the legislation is moving forward. This is something that hasn't happened in years. And, I said, and this is my baby. And she turned to me and she says, well, that baby has many mamas. Because as it started to take hold, and I can tell you there was nothing happening in this area before we agitated the waters. The thing that I thought was really great is several key political leaders. At the time, our city council, our current mayor was city council president. She took an interest in this, in that position, and now as the mayor has a profound capacity to move things forward. And so several key political leaders took the reins and owned this as their issue, which was great for us because our capacity to move it forward is limited. So literally now, the alcohol legislation, the zoning, and all of that baby has many mamas in the community. What they did, though, is the folks that were driving the train, a few city council people, the mayor, they tasked us with providing ongoing data and support for the legislation. So one of the things that I did is I produced a report for every single council person so they would know exactly where the stores that were in their community that were going to be impacted. I overlaid the location of liquor stores with violence. I showed them where the violence was clustering around particular outlets because I thought you as a council person now have the data that you need if you want to bring a scalpel to the problem. You can start dealing with your problem outlets now, and when the legislation gets passed, it won't be the mallet or the sledgehammer. So we started to provide them with this ongoing data and support for the legislation. And then there were several other complementary efforts around alcohol outlet monitoring that surfaced as a result of this. So one of our new city councilmen, his name's Nick Mosby. You might know his wife, Marilyn Mosby. And I sponsored a bill that prevents youth from making any purchases in liquor stores. And so once we got all of the momentum going around alcohol, everybody jumped on board. I will tell you, in the 3 years since this really has taken off, we've had 37 bills related to alcohol in our state legislature. In the previous 3 years, we had 8. So this is something that really took hold at a level even beyond Baltimore. All right, I'm going to skip past that. So here are the results to date, and then I want to tell you some of the lessons that we learned. So we have had very heated public testimony on this issue. The recommendations were made, and we also work with our local planning commission. Recommendations had been made to the city council by the planning commission in favor of this bill. The bill actually was read into committee in April of 2013. Now remember, we capitalized on an existing effort. So Baltimore is undergoing a comprehensive zoning rewrite. It has 18 components to it, and it's around 450-page document. And last I checked, about a month ago, they were on page 238. I think now they're up to 270. Mostly before I present, I check in to see where they are so I can sort of give progress. We had several city council sponsored public forums specifically on the alcohol aspect of the legislation. We've had very strong community and stakeholder mobilization, and our political allies have turned many of their colleagues in ways that we as academics and researchers couldn't. And now we actually have the votes. So whether or not the comprehensive effort makes it out of committee, we don't know, but the alcohol piece looks like we now have the votes to do that. And that was through our political allies, not through our own solitary efforts. So that council hearing to introduce the entire zoning bill is expected to happen late fall, early winter of this year. I have 2 minutes, so I'm going to skip here because this is the thing that I think is most important. So what did we learn in this process? So the first thing is, while we very upfront made a very clear case for environmental policy interventions as a means to impact health and health behavior, the data were only compelling when there was some political will for change. And we did a lot of work to create that political will. And that is something that I think that researchers undervalue and underestimate the role and the impact that we can have and that our research has. But it requires a particular intention. It doesn't happen by accident. Action-oriented research requires buy-in from multiple partners and multiple sectors. So we had to bring the business sector into this conversation. So when you go to some of the neighborhoods, there's one block in Park Heights, which is sort of one of the underserved communities in Northwest Baltimore. They literally have 4 liquor stores in 1 unit block. There's 4 liquor stores in 1 unit block. The only other kinds of businesses that you get on blocks like that are places that sell chicken boxes. They have a few of the Boost or no contract required mobile phone companies, which are known to be the preferred phones for drug markets, and tobacco shops. No one's going to put a daycare there. No one's going to put even a McDonald's. No major chain restaurants are going there. So what happens is, when you get these communities that are, overly saturated with these types of stores, they become deterrents for other types of businesses to come in. So we brought in multiple sectors: business, health, policy, and I say that multiple stakeholders have to have some skin in the game. And one of the things that we did is we sort of served as a coordinating entity to bring those stakeholders to the table. Also, to capitalize on existing policy and public health efforts, researchers have to be connected to and knowledgeable about the landscape. Like I said, I stepped on a few landmines, and I think there are avenues for how to do that. I think Christina made a really great point. We're not really trained on how to do this. We're not really incentivized. There's no place for me to document any of this kind of work on my CV in any way that's meaningful. Really, but it's meaningful for me, and I think it's important in the field. And so one of the things that I can appreciate that are happening at many schools of public health, Hopkins has a really great division of external affairs. So there are people whose job it is to understand the landscape politically, both at the state level and at the local level. So I was able to tap into some resources within the university and outside of the university, but I really had to take on for myself, if I really wanted to play in this field, I also had to take on some personal sense of ownership and learning the landscape. And then finally, probably the most important thing that I've learned in all of this is it's absolutely all about relationships. Most of what we were able to do was the relationships that I had forged with my colleagues, the relationships that we forged with our political leaders, the relationships that we forged with the people from the health department. And so that's another thing that they also don't teach us about, and some of the quirky academic folks are not necessarily good at. That's it. Thanks.